Cardiovascular system. Definitions. Stroke volume. The volume of blood pumped out of the left ventricle of the heart during each systolic cardiac contraction. Cardiac output. Cardiac output is the volume of blood being pumped by the heart per unit time. Heart rate. The number of heartbeats per minute. Blood pressure is the pressure of circulating blood against the walls of blood vessels. And diastolic volume, the volume of blood in the left ventricle at the end of filling the heart in diastole just before systole. And systolic volume, the volume of blood in the left ventricle at the end of contraction or systole. Ejection fraction. Ejection fraction refers to the amount of blood being pumped out of the left ventricle each time it contracts. Ejection fraction refers to how well left ventricle or right ventricle pumps blood with each heartbeat. Hypertension. Hypertension is a condition in which an individual's blood pressure is higher than normal. Pulse pressure. Difference between the upper and lower numbers of blood pressure. Systolic blood pressure. Maximum arterial pressure occurring during contraction of the left ventricle of the heart. Diastolic blood pressure, the lowest arterial blood pressure reached during any given ventricular cycle. Mean arterial pressure, the average pressure in a patient's arteries during a cardiac cycle. Vascular resistance is the resistance that must be overcome to push blood through the circulatory system and create flow. Systemic vascular resistance or total peripheral resistance. The resistance offered by the systemic circulation is known as the systemic vascular resistance, or by older term total peripheral resistance. Isovolumetric contraction, an event occurring in early systole during which the ventricles contract with no corresponding volume change. Isovolumic relaxation, that part of the cardiac cycle between the time of aortic valve closure and mitral opening, during which the ventricle muscle decreases its tension without lengthening so that ventricular volume remains unaltered. Preload is the amount of sarcomere stretch experienced by cardiac muscle cells at the end of ventricular filling during diastole. Afterload can be thought of as the loads that the heart must eject blood against. In simple terms, the afterload of the left ventricle is closely related to the aortic pressure.